Hello YouTube, today I'm gonna talk about combined pill. So what is the combined oral contraceptive pill or the pill? The pill stops you getting pregnant by releasing hormones called estrogen and progestin into your body. Although there are many brands, there are three main types. They differ in how the hormones are administered and the schedule you should follow to take them. So it's important you know the instructions for the particular type of pill you are taking. Most women take a monophilic 21-day pill, which has equal amount of estrogen and progestin. You take one pill every day for 21 days and then none for the next 7 days. The 21-day pill packet is marked with the days of the week. When you take your first pill, make sure you take the one for the right day. Carry on taking them at the same time every day until all the pills are used up. Then count 7 days until you start on the next packet. You will have a period during these 7 days. Start the next packet on the 8th day, even if your period has finished sooner or is still going on. You check you are doing this right because you should be starting each packet on the same day of the week. On the other hand, basic pill come in packets divided into 2 or 3 sections, each of which contains differently colored pills. Each color has a different amount of hormones. You follow the same schedule as monophilic pills. Take one each day for 21 days and then none for the next 7 days. These pills are not marked with the days of the week. You have to be careful you take the different colors in the correct order. Everyday pills come in packets of 28. 21 are active and 7 are inactive. You can tell the two types apart because they look different and the section marked start contains an active pill. When you have taken all the 21 active pills, you take the inactive pills for 7 days, during which you will have your period. You must start taking the next 21 active pills on the 8th day, even if you are still bleeding. Whatever type of pill you are taking, there will be full instructions in your pocket and you must follow these carefully. Otherwise, you may not be protected against pregnancy. For example, taking pills at different times each day or when you are also taking another medicines may reduce the effectiveness of the contraceptive. If there is anything you are not sure about, ask your doctor. Okay, so how does it work? The pills contain artificial versions of two hormones your body naturally produces in your ovaries, estrogen and progestin. They stop you ovulating or releasing an egg and produce more cervical mucus, so it is harder for sperm to get into your womb. Also, they make the lining of the womb thinner, so even if a woman ovulates and the egg is fertilized, it has less chance of attaching itself to the womb. So do you have to start taking the pill on a particular day in your cycle? Generally, you can start at any time during your cycle. However, sometimes you will need to use a condom or some other sort of other contraception if you have sex during the first few days of being on a new hormonal contraceptive. If you start taking the pill on day 1 of your cycle, for example the first day of your period, it will be effective straight away. If you start taking the pill before day 1 and day 5, it will be effective straight away unless your menstrual cycle is shorter than 23 days. If it is, you need to use a condom for the first 7 days you are taking the pill. Similarly, if you start taking the pill after day 5, you must use some other type of contraception for the first 7 days. Also, if you start on day 5 and have had unprotected sex since your last period, remember there is a chance you may already be pregnant. Okay, question. What should you do if you forgot to take a pill? Not taking all the pills or taking them late can mean the contraception will not work. Whether you are likely to be pregnant depends on how many pills you have missed. Okay, next. Is it 100% reliable? If you use the pill properly, you have 99% protection against pregnancy. Properly means taking it at the same time every day, because if you take it at different times, it loses effectiveness in some way. Even higher protection rates are given by some other methods of contraception, including the IUD, IUS, implant, and injection. Also remember that if you vomit within 2 hours of taking your pill, your bloodstream may not have completely absorbed it. so you should take another one immediately and then take the next pill at the usual time. To be completely safe, use a condom or other contraception until you have gone a full 7 days without being sick. The same holds if you have had diarrhea, so you should carry on taking your pills but use another sort of contraception as well while the diarrhea continues and for at least 2 days after it stops. Okay, next. Is the combined pill suitable for all women? My answer is no. Some women should not take it. If you are or have been a smoker or you are obese, you should discuss using a different form of contraception with your doctor. In particular, if you are over the age of 35 and you smoke or gave up smoking less than a year ago, you should not take the pill. Women with certain health conditions or family medical histories should not take the pill. These are thrombosis, stroke, high blood pressure, high cholesterol, or any heart condition, severe migraines, particularly with aura. You get signals warning you a migraine is coming. Breast cancer, any gallbladder or liver disease, or diabetes-related complications. Another risk factor is being immobile for a long time. For example, if you have been in a wheelchair or in bed because you have broken your leg. If anyone in your close family had thrombosis before the age of 35, do not take the combined pill. If you are already taking certain medicines, you need to find an additional form of contraception such as condoms, as these may prevent the pill from working properly. The pill may not be effective if you're taking the antibiotics rifampicin and rifampicin, certain drugs used to treat epilepsy and HIV, and herbal remedy. Although all these drugs are listed in the patient information sheet, you can also ask your doctor, nurse, or pharmacist if you are not sure, and for advice on other forms of contraception. If you are not in any of the risk groups, you may be able to carry on taking the pill right up until menopause. Okay, next question. Why would you choose the pill? The pill can have several advantages over other methods. Firstly, you will probably have shorter, lighter, more regular periods, and a lot of women find they have less period pain and fear menstrual-related migraines when they are on the pill. In fact, the pill is sometimes used as a medicine to treat conditions such as period pain and heavy bleeding, and the underlying conditions which can cause them. Some women also find their skin is better when they are on the pill, as it can improve acne, and also that they have less unwanted hair. It has also been shown to decrease the risk of certain cancers, such as ovary and colon. Taking the pill will not make you put on weight. Next, are there any disadvantages? My answer is yes. As with all medicines, there can be side effects. Some women taking the pill suffer from headaches and nausea, and their breasts became tender and painful. It can also have an impact on your emotional stability. Even if you are not in one of these categories, there is a chance that you will be at more risk of deep vein thrombosis or DVT, or breast cancer if you take the pill. The risk of breast cancer returns to normal 10 years after you come off it. It is also possible that a link exists between taking the pill and cervical cancer and a rare type of liver cancer. One last point to bear in mind is that unlike condoms, the pill will not give you protection against sexually transmitted infections or STIs. Okay, question. Can you go on the pill after you've had a miscarriage or abortion? My answer is yes. If you start taking the pill in the first 5 days after you had a miscarriage or abortion, you will be protected immediately. However, if you start taking it more than 5 days afterwards, use a condom or some other form of contraception as well until you have been taking the pill for a full 7 days. Okay, how soon after giving birth can you go on the pill? My answer is wait at least 3 weeks after your baby is born before going on the pill, because your risk of DVT is greater in those first few weeks. If you are more likely to develop DVT for other reasons, for example because you are taking pills containing drospirenone or using a contraceptive patch, you should wait for 6 weeks. Okay, then where do you get the pill? The pill has to be prescribed by a doctor, so you need to visit your doctors. You can't get it at a pharmacy. Okay, next, can you change from one pill to another? My answer is yes, but you will need to check with your doctor first. You shouldn't have any break between finishing one cycle and starting another, and you should use an additional type of contraception, like a condom, for the first few days, as it takes some time for the new pill to become effective. Okay, last question. Can girls under 16 take the pill? My answer is yes. You can visit a clinic even if you are under 16, and the doctor or nurse who talks to you will not let your parents or carers know you have been there, as long as they are sure that you have understood all the information they give you and are able to make an informed decision. However, if health workers think that you are at risk for abuse, for example, someone is forcing you to get contraception, they may want to tell someone else, but they will always discuss this with you first. Okay, thank you for watching. See you soon.